And also, if you could add me as a co-host real quick.
Let me know when to start, Maylin.
Okay, let's wait for a few people to roll in. Should be able to begin here in just a second. All right, we are live. So let's take a quick photo before I forget, and then we can get started. All right, everybody smile big. All right, perfect. Go when you're ready, Mayor.
Good morning, everybody. This is Mayor Woody Washam, and you have joined Connecting Cornelius, our virtual coffee chat. Welcome. Glad to have everybody with us today. It's a little bit of a cold, rainy day in Cornelius with a little ice maybe predicted, so things should get interesting here maybe in a little while. But I personally had enough of this icy stuff, and I bet most of you have as well. But that won't damper a good program we have for you this morning, and welcome you here. Those of you that are on our Zoom presentation, if you have questions, you can certainly put those in the Zoom chat, and we will be happy to address as many as possible today. And if we can't get all of those addressed, then we will certainly get back to you by email or other avenues of communication. So again, thank you for joining us, and we appreciate your attendance today and your interest in your town. I'll also remind everybody, we do have a town board meeting tonight at 6 o'clock at Town Hall. So everybody's welcome to join us if your schedules permit, or if not, you can certainly join us on the town's webpage or virtually through Zoom through the town's Facebook page as well. So off and running here. So first of all, I'd like for us to turn to our new public health director, Dr. Raynard Washington. Dr. Washington, I don't see you on my screen, but I bet you're out there somewhere. So we would like for you to give us a little bit of an update. Certainly we'll have an opportunity to ask you questions along the way. So if you will jump in and give us an update on what's going on in the public health arena, particularly COVID, we would appreciate that.
Mayor, it looks like Dr. Washington actually hasn't joined yet. Let me send him a quick text and see if I can get him in.
Okay.
And maybe we can go ahead and start with our transportation update.
We will move right on to transportation, then hopefully Dr. Washington will sign on here shortly. At every event possible, we want to give our citizens an update on what's going on with our transportation projects and endeavors here in town. We know we've heard you citizens tell us that transportation is one of your, if not your highest priority as we work through the workings of our town government. So I've asked our Deputy Town Manager, Wayne Heron, and also others on the town staff like Tyler Beardsley and others that might have some input for us to give us an update on what's going on the projects that are so important to all of us here in Cornelius. So Wayne, we'll turn to you, sir. Thanks for being here.
Thank you so much, Mayor. Appreciate the opportunity. I have my standard slideshow here. We've got a couple of changes in it that we can announce this morning. So we'll just kind of move through this and try to give a quick update and answer any questions we can. I always like to show this map. I let everybody know that coming up over the next 5 to 7 years, Cornelius has approximately 13 DOT projects that are coming to our area. I always make sure to tell folks I have been in government over 34 years and never had a jurisdiction of our population have 13 projects. This is phenomenal. Now, I do always say we're owed every single one of them. A lot of the reason that we're getting 13 at one time is that we've gone many years without any project. So we're certainly owed all 13 of these over the next 5 to 7 years. It certainly will be transformational for our town once all is said and done. I got a couple of slides on some local projects. Tyler, are you out there? Well,
Yeah, I'm here.
go ahead. Can you see? I've got
I'm
Bailey 115 on the screen. If you want to talk about that.
Yeah, thanks, Wayne. So Bailey 115, this project's just about complete. We just have permanent striping remaining. This morning about doing it later this week. It looks like we're going to have several days of warm temperatures and dry weather. So hopefully we'll be able to wrap that up the end of this week, and then that one should be buttoned up. That'll be a good one to get off the ground and finalized. Next one is the Jim Street Extension Project. The town board approved a contract for this with Sealand out of Charlotte. Right now, Sealand has ordered water line pipe and storm water pipe, and we're just waiting for that to come in. So at this point, they're waiting. Sealand anticipates starting that in mid-March. So about 4 or 5 weeks from now, they'll start. And that project is scheduled to be complete by the end of calendar year 2022. So that's all I had.
Appreciate that, Tyler. So I'll jump into 2023. The Highway 21 Catawba, they're currently doing utilities and right-of-way as we speak, wrapping those up and beginning the utility relocates. This will be a dual roundabout that will start early next year. It's got a 1-year construction schedule on it. These roundabouts are pretty easy to construct, so that should be in fairly quickly next year. North Cross Drive Extension. This project actually goes from Westmoreland all the way down to 73. What you see on the screen is where the new roundabout will go on Westmoreland, right at Eagle Ridgeway Lane. This project is scheduled to also start in 2023. This is one you probably won't notice too much because the majority of the project will be off the beaten path. So a lot of this construction will take place and it will not affect day-to-day traffic at all. This will be a great north-south connector, scheduled to be completed in 2025. There's a major culvert, a stream crossing, and greenway crossing that we have to work through, but this will be a great north-south connector. The Torrance Chapel project. Here again, 3 roundabouts, one at the post office, one in front of Lake Norman Jeep Chrysler Dodge, and one up at Torrance Chapel in Knox. Be a total resurfacing and reconfiguration of Knox to get bike lanes, new pavement, redoing the signal at 1 Norman. So this will be a great project for congestion in the Knox Road, Torrance Chapel area. Again, scheduled to start in 2023. They'll break this up in 3 phases to try to ease the pain. So you'll see work starting, I think they're going to start on Knox Road first in early 2023 behind Chick-fil-A and try to get all that worked out. Then move to Lake Norman Jeep Chrysler Dodge area and then move over to the post office. So it'll be in segments and phases. Next is the 115 Potts Roundabout. Most people look at this as a great safety and congestion reliever for the YMCA and all the traffic that we have around Davidson Street now. This will be a very much needed project. One of the big wins is the pedestrian access under the rail. Right now, you're taking your life into your own hands if you walk or ride a bike under that bridge. This will give us a nice multi-use path that folks can easily bike and walk to Davidson. And let me jump back in the schedule. This is also scheduled to start in 2023. They're wrapping up the right-of-way as we speak. Bailey Road Extension. This on the map, if you look at the right side of the map is right where the sharp curve is in the existing Bailey Road. The left side of the map shows the existing Highway 21. So this will punch Bailey Road out from that curve over to 21. It's a very short section, but will be very critical. We have a lot of industry and business going in on Bailey Road. This will give them better access so they do not have to come through the Oakhurst neighborhood and come through our where 131 Main and Cowboy were previously located. So hopefully this will be a nice safety addition. We also have the greenway that crosses there behind Oakhurst. So this will put the majority of the traffic in a different place so we don't have conflicts at the greenway and Oakhurst. This is scheduled to start in 2023 as well. I-77 shoulder hardening. This is still scheduled to start next year. This is one that a lot of people talk about, but I'm very excited about it because I've mentioned before, I have traveled to places where they have the shoulder hardening, and these lanes really do provide relief. They're good in between each ramp. So this will be something that will be good for 77 that will add some capacity in between the different ramps. 2024. You'll notice this project has moved a little bit. This project used to be in 2023. We're not happy that it has moved to 2024. DOT says that they need extra time to do design and work with their engineer. The mayor and the Board of Commissioners, the mayor's written a letter to the Secretary of Transportation to let him know that we are not happy with the schedule change. All of our road projects are meaningful to our residents. They all provide some congestion relief and safety. And so I think the mayor and the board are going to be doing all they can do to communicate that this schedule change is unacceptable and that we would like to have this move back up to 2023 or even sooner. So certainly this is one that's on the board's radar, that we are not going to just sit back and accept that schedule change. We are going to try to fight to move that schedule up and keep it as quickly as possible. West Catawba Phase 2. This is our big project. This is now a $50 million project, 4-lane West Catawba from Jatun all the way down to 73. The one bright spot on this project is that DOT has never stopped right-of-way acquisition. So that has kept the project really moving and on DOT's plate. Construction is currently scheduled from 2024 to 2027. But because DOT continues to acquire right-of-way, it enables us the possibility of moving up. And so we are continually pushing. Whenever funds become available, we would like this to move up in the schedule, but it is still funded and it's still there. So we are very happy and look forward to this project. In 2025 and beyond, we still have the Highway 21 widening project on the DOT's plate. Currently, it doesn't have a year in the tip, but there's a lot of things happening that we think will move this project back up, specifically the atrium project and just the congestion needs that we have that we think will move this project back into the funded cycle. NC 73, there are 3 projects here. The county line over at Lincoln County, up through Beatty's Ford and over to West Catawba. We have one from West Catawba down to 77, and then one from Concord Road over to the county line of Cabarrus. All 3 of those projects are scheduled to start in 2027. Now, the majority of those projects are in Huntersville or other jurisdictions, but this is a road that's important to our residents. We all use it, and we all want to stay in the loop about that 2027 construction date. This just shows the new realigned intersection at Catawba and 73. So, Mayor, I'll stop there. I'll answer any questions that board members might have, and see what questions might pop up from our listeners.
Okay, I don't see any questions out there. Commissioners, do you have anything to add? Several of our commissioners are on the call today. Welcome, commissioners. I can't see you all, or I would call your names. But thank you for being here, part of it. Any questions or input you'd like?
Real quick. Yes, sir. Real quick, we also have expansion, or excuse me, a resurfacing and a replanning essentially of that Jatun Road extension, right, Wayne?
Yes, sir. That is currently in the town CIP. That is not a project that we were able to get funding through DOT or federal highway. So we have that. It went out to bid in December for design work. And so we'll be completing the design work over the next 2 fiscal years and intend to start construction, I believe, in 24 is right now what the schedule is. We'll continue to discuss the design, continue to discuss the schedule, and try to move that one along as quickly as possible. But you're exactly right. That'll be another great project that will be good for east-west connectivity and improving how the safety of that facility.
Yeah, thank you, Commissioner, for bringing that up, because it is an important project. It's a dangerous street, and it's certainly a priority for our board and for me to get something done there. So it's on the way. Let's see, I think we might have a question from Kim Ratliff. She says, can you please email the presentation on the projects? So Kim, if you'll supply your email address, possibly Maylin has that. We'll get that to you. Thanks for asking. Be happy to provide that. Any other questions or comments from our commissioners or folks on the line here? Not seeing you. Thank you, Wayne. Appreciate
Yes,
another.
sir.
We're staying on top of these transportation projects. It's important to get them done and get them done when the DOT tells us they're going to be done. So that's a high priority for me. It's a high priority for your board, and we intend to make that happen ASAP as DOT hopefully comes back with their funding opportunities and has an opportunity to maybe spend some of the infrastructure money as well that may be coming our way. So thank you. Next, we will turn back to Dr. Raynard Washington. Dr. Washington, I know you're on our line now, and we welcome you as your first official presentation here as our public health director to our Connecting Cornelius Coffee Chat. We appreciate your input. We have worn your predecessor, Gibby Harris, out over the last many months, but we appreciate you stepping in, and I know you'll do a good job, and congratulations on your elevation to your new job now. So Dr. Washington, I'll turn the program over for you, and I think we'll probably have some questions for you as we proceed toward the end.
Wonderful. Well, thanks, Mayor, and I appreciate it. And good morning to everyone. I apologize for the connectivity issues. When it rains, we sometimes have wired network issues. So, but nonetheless, let me just jump right in and give a quick update on where we are with COVID-19 in the county. I am pretty confident. I think, as everyone knows, we have been dealing with our worst surge of COVID due to the Omicron variant here in Mecklenburg and across the state and across the country. I'm pretty confident that we have hit our infection peak in that surge and are headed downhill, which is a really good thing because it has been we had some rough patches there with really high transmission, high testing demand. But all of our early indicators are showing really good progress. The same is true as well for our hospitalizations. I was just looking at the numbers a couple minutes ago, and they are declining very nicely, as we would hope that they would. And so I think we are through the thick of the surge, but certainly it's not at the at levels of transmission where we were, for example, last fall or last summer. We are seeing, starting to see a pretty aggressive uptick in deaths among individuals who have been in the hospital for a while. That is typically a lagging indicator. And so we kind of anticipate that with, we had well over 600 people in the hospital over the last several weeks. That has gone down closer to 500. And I imagine it will continue to trail off over the course of the next couple of weeks. We are currently at about 62% of our residents have their first dose of one of the vaccines. Have both of their doses of one of the vaccines. About 30% have received their booster doses, and roughly 67% have received at least one dose of vaccine. As I've said on this call before, the evening version, we know the vaccines are highly effective. The majority of the people who are in the hospital, the majority of the folks who have passed, unfortunately, recently, were not up to date on their COVID vaccines. And so we know they work, we know they're effective at protecting against severe illness and death. So we are continuing our efforts to make sure that vaccines are widely available in the county. And that folks, and also continuing the conversations that are necessary to get people from the point of hesitancy to being able to go ahead and get their first dose and start the series. Our long-term care facilities, of course, are a number of those facilities are in outbreak status. They have managed very well through this surge compared to other surge previously. I think we have roughly 68 or 69 of those facilities still in outbreak status. Again, the majority of their residents are, while they're medically vulnerable, they are fully vaccinated and most of them have been boosted. And so we have not seen the kind of death from our long-term care facilities that we've seen in previous iterations or previous surges that we've seen. There is a lot of discussion about sort of what next looks like for us as we respond to COVID. And so I think we are in sort of really a really interesting point of transition where we are going to really begin to sort of modify our response to COVID with the expectation that COVID is going to be here in our community and surging at various intervals throughout time. And what that means is still not completely clear, but what it does look like, and to give folks some sense of what we're doing as we're beginning to transition our back end activities, including our contact tracing and case investigation. Those were really important tools that we utilized when testing was not widely available, and that when we had less transmissible variants of the virus, with the level of transmissibility that, for example, Omicron variant had, it spreads really, really easy, and it makes contact tracing a lot more difficult and less effective. So we have actually transitioned already from doing contact tracing and case investigation for the general public. And so now we're focused specifically just on certain higher risk settings like those long-term care facilities, our shelters, prisons, as well as schools to reduce transmission in those settings where you have a high density of people. We are also working on sort of an analysis to look at what point is the appropriate time for us to rescind the current countywide indoor mask mandate. And so we are working on a proposal to really sort of articulate what that transition looks like as well. Previously, the current version of the public health rule that's in effect does rely on percent positivity to determine at what point the mandate automatically lifts. There also is an opportunity for there are a couple of other conditions that could also take effect. For example, the board voting to get rid of the mask mandate as well. And so we're working to make sure that we're advising them on the most relevant and latest information in this space. We are so close to being out of the Omicron surge. I do think that in the near future, given the numbers that we're seeing today, the volumes that we're seeing in terms of testing, I do anticipate that we'll start to see a really sharp decline over the next couple of weeks, at which point I do believe we'll be in a better position to discuss what happens next with the indoor mask mandate. So I'll stop there in terms of my updates. I know those have been the most critical topics of discussion, and see what questions people have. If there's something else that folks want me to talk more about, I'm happy to spend some more time on any particular topic.
Let me bring a couple things up to you that we have heard from our citizens regarding particularly mask mandates as it relates to schools. Now, my assumption is that follows the county mandate that's in effect. Would you talk about that just a little bit? And you know, I think everybody's getting tired of these masks.
Yeah.
But we do want to stay safe. But if you could just make some comments around that, we would appreciate that.
Sure, everyone's tired, me included. So the reality is, the public school district certainly has the responsibility for setting policy for the schools there. And so based on state guidance for them, they would actually, the CMS, the Board of Education actually sets whether or not they have a mask mandate in CMS. That will in fact be up for consideration, has to be reconsidered on a monthly basis based on the state legislatures basically saying every school district has to reassess on a monthly basis whether or not they have a mask mandate in place. So for public schools, they'll reassess actually this week at their meeting. And because we have a countywide mandate in place, they've essentially said, you know, we can't vote otherwise because the county mandate's in place. And so until the county mandate's not lifted, then they could actually consider doing something different. I don't know that they would, but they could consider doing something different at that time. For private and colloquial schools and religious schools, those schools, again, are subject to the county's indoor mask mandate. And so at the point that the county lifted that, then those individual entities would make a policy decision about what they do or what they implement on their various campuses.
Okay. Commissioners, you have any other questions regarding that? I know we've received some emails in that regard. Anything else? Is that?
Yeah. Hey, Dr. Washington, this is Commissioner Sansbury. Good morning.
Good morning.
Hey, by the way, thank you for stepping up to such an important leadership position. I know there's a lot on your shoulders, so thank you for doing that. I do have a couple of questions for you. So you mentioned that death is a lagging indicator. What's the major leading indicator? I don't know if that's a fair question, but do we look at people seeking tests? We look at, urgent care visits. Do we have a leading indicator that positivity rate may increase?
Sure. Yeah. So I think the most pronounced leading indicator that we've seen, there are two actually. The first is testing demand. So when we start to see a high increase in testing demand, that cannot be explained by something else. And so, for example, we saw a high increase in testing demand ahead of the Thanksgiving holiday, but we recognize that a lot of that was related to individuals doing sort of asymptomatic folks going to get tested as a precaution. But if you start to see the demand go up and there's no real explanation to it otherwise, then that is certainly concerning. Obviously, the case count is one indicator of increasing rates, but as we all know, that can also take some time for us to recognize it. The other important indicator, which we use also for flu surveillance, is the proportion of people coming to the emergency department with flu-like or COVID-like symptoms. And so we are tracking that on a daily basis. And so what I imagine so flu surveillance right now, to give folks an example, now the COVID and flu are not the same. So just to be clear with folks, they're different. I know a lot of folks want us to just treat COVID like the flu, but they're not the same. The flu did not kill 50 people in the last 2 weeks. So they are two different viruses and they have different levels of morbidity and mortality. But our flu surveillance systems really rely on that emergency department data. It's called syndromic surveillance. So basically it's a syndrome that we monitor to see what's happening. And we've been validating it for COVID use as well. We've also been looking at and will be likely incorporating some aspect of wastewater surveillance and the overall sort of the next phase of I'm going to call it surveillance 2.0. So like what our second phase of surveillance looks like. And so looking at wastewater. And so in Charlotte and Mecklenburg County, in various locations across the county, there are collection sites for us to be able to collect wastewater samples. Those wastewater samples then we're able to actually measure the level of COVID viral particles in the wastewater. And it's been validated over the course of the last several months to really demonstrate to us that it works, right? So that when we start to see an uptick in genetic material in wastewater, we know that COVID cases are increasing. In fact, our partners at UNC Charlotte were very instrumental in getting that work started in the state. And by collecting wastewater samples from their residence halls. I won't spend too much time on it, but it's really cool for anyone who's like a science person. They were collecting wastewater from all the residence halls and were able to sort of see as COVID cases, even as little as 2 cases in a residence hall, they could begin to detect it in the wastewater. And so that's going to become a part of, I believe, the surveillance system that we rely on across the state to be able to say what's going on with COVID. And then, of course, the lagging indicators do tell us what the strain is on the system and how much risk we have with the current levels of transmission based on how many people are in the hospital and whether or not those services are impacted.
Oh, no, that's interesting. Thank you for that. My second question, real quick, you mentioned possibly reevaluating some of the mandates based on infection or positivity rate. Is that threshold still 5%?
So currently the Board of Health rule does say 5%. One of the challenges is, not a challenge, but the way the process works is to make any modifications to that, we have to go to the Board of County Commissioners. They have to meet as the Board of Health. And then they have to, once they propose a change, then that change actually goes into effect after the rule has been posted for a 10-day period. So if you think about the meeting schedule and the time that it takes to do all that, if we get to a point where we've achieved that goal that we might change it to, it might be better to like achieve the goal and rescind it so it happens immediately as opposed to waiting that 10 to could be longer a day window for that to take an effect. So we are looking very closely, and I can't tell you how many emails I've received in the last week since last Tuesday night's meeting. And I'm sure someone's put my email address on a Facebook group or someplace, and it's a very concerted effort, and it's okay. And I appreciate people being engaged and voicing their concerns and how they feel and what's going on, and it is helpful. But we are aware of where we are in this pandemic. We have been doing this for almost 3 years in some way, shape, form, or fashion. And so the work that's happening here, we need to transition as well, because there's a certain level of unsustainability in some of our response activities. And so all these things are happening, and I'm committed to being as transparent as these steps occur. But of course, it is difficult to think about, and I said this last week, if we still got 600 people in the hospital and people are waiting 8 hours in an emergency department room, it's difficult to think about lifting mitigation measures at a time where we have, still are getting 1,000 cases reported a day. Similar to other big cities like New York City, for example, and other countries that are further ahead in their Omicron recession, they dropped right back down in a 2-week window. And so giving it the time it takes for the surge to recess, I think is what we're trying to do here. And we'll as quickly as possible lift any mitigation measures that will not be necessary or not critical, or give people the option, for example, without the mandate.
Thank you.
Right. All right. We've got a good many questions from some of our citizens, so I want to start down those, and maybe as concise as you could be, Dr. Washington, would be wonderful, and but certainly give them a thorough answer as needed. So, first one is, what is the current community transmission infection rate in Cornelius and/or Mecklenburg County?
Sure. So as of and I'm sorry, I did not print the Cornelius town report. But as of last Friday, our percent positivity in Mecklenburg was right around 24.8%. And actually, I just saw an email, and this morning it's about 21%. So over the weekend, it's gone down about 5% points. And so I expect that will continue to decline pretty dramatically this week, just based on the demand of testing currently. And I will have to get the percent positivity in Cornelius. It will actually be as of about a week and a half ago, so it's not as current. So I'll work to get a more current one to you guys, so that folks can sort of know where things currently stand in the town.
Right. I had also heard that the vaccination rate in Cornelius was in and around 70%, which sounded pretty good to me. Can you verify that as well?
Yeah, so give me about 30 seconds and I'll be able to get an answer to that. But my recollection does tell me it is a bit higher than it is countywide, which is certainly good.
Yes, that's good news for us.
So there are about 70% of residents in Cornelius that are fully vaccinated, which is higher than the 62% that's countywide. So that's good.
That's good news. Okay. Next question, is the county or any other agency keeping track of those that have recovered from COVID infection and presumably may have natural immunity? Mike Miltic wants to know the answer to that.
Sure. So Dr. Mike, we certainly keep track of every case that's reported. One of the challenges that we face with that now is that with the higher availability of home testing kits, we know that is going to continue to be an underestimate of the reality. But we do, any person that was tested in a laboratory setting or in a physician's office or a testing site, and that was processed at as a PCR test processed at a lab, or even a rapid test processed at the physician's office, those individuals' reports are kept in the record. So we do have record of every case. Previously, we also track reinfections. So when people get, reinfected again, we're able to also match that with the vaccine registry to see, how our infection rates compare among vaccinated versus the unvaccinated. Again, all that will continue to be complicated by the availability of rapid tests, which I should have probably talked a bit about testing in my earlier comments. But if you haven't already, please feel free to go to covidtest.gov and order your free 4 test kits for your household. It is very good to have those available, because especially as we're still in the middle of cold and flu season, if people have symptoms. The last thing I'll say about immunity or natural immunity, more people got infected with COVID during this surge than I believe at any point in time in the entire pandemic. I think I could probably see head nods around this discussion here that everyone knows somebody that has COVID, and I'm sure at least a few of us on the call have had COVID. And so because of that, we do know that there's going to be a great deal of immunity in the community due to those sort of natural immunity that's on board for those individuals for some period of time. One of the challenges with natural immunity as well is that we don't know exactly how long it lasts, and how long it lasts varies for each person. And the specificity of that immunity is really tailored by the variant that you had. And so whether or not that's going to protect you from other variants that emerge is still, that's all the natural course of disease. But it is true that so many of us in the Mecklenburg County across the state, so many people were exposed to COVID in this last surge, that in fact it is very likely that we have a greater degree of immunity in our community. We also have so many folks vaccinated. All those things together, I think, are really what help us be able to confidently say, that we are in a much better place with this pandemic. We managed through this last surge with the exception of testing issues. We did a really good job as a community. I think folks, nothing closed. People were able to sort of manage. A lot of folks had staff out, a lot of workforce impacts, but people were able to sort of work through that. And so I think we're learning, and I think as we continue to learn, we will start to see a lot more of what I guess folks call normal in the next several weeks to months.
Okay, one more, and I think that will probably wrap us up. It says the county could restrict mask mandates to adults only, as children have so little risk. Have you thought about that?
Sure. Yeah. So, children certainly do have risk relative to transmission and can transmit it to other children, other adults. And so there is risk there. Certainly, we have seen fewer children severely sick, vaccinated or not, that compared to adults. But there are kids who have gotten really, really sick and have had really complicated cases of COVID and even died. And it's unclear what about those kids was different, because many of them were healthy. They weren't like they were what the older adults that have pretty significant underlying health conditions that you can kind of see where they were medically fragile. But if you have a healthy 7-year-old kid who gets COVID and ends up on a ventilator, it does make you wonder sort of what about that kid, created that risk. I'll go back to specific to the mask mandate. I'll go back to my earlier comments. The process to change the mask mandate at this point is at a minimum a 12 to 10 day process. And so if we were to modify the current mandate, and so we are at this time really looking to figure out, one, are we going to be a point of changing the mandate or completely rescinding it? Because again, we're making this transition into how we respond to COVID. And so I think those two things are what I'm working to balance right now. And I look forward to, I go back to the board again next Tuesday night, I think. And so I'm sure we'll have just as a lively discussion as we had last week, next Tuesday, and we'll see where we go from there.
All right. Thank you, sir. Let's see if there's anything else we just need to jump on.
Hey, Mayor, I'm happy to type some answers in here too. If we missed any questions, I can do that.
That'll be great. If you can
Sure.
do that, wonderful. And I will relay a message from Pam Jones that you can see on here, I'm sure. But adding to my thanks, Pam just wants to say to you that just wanted to thank you for your very clear and thorough responses to the questions today. So you've always been known for that, and we appreciate that. And if you can just maybe address a couple of the other questions, and we'll move on in our topic today.
Sure. My pleasure. Good to be with you guys.
Thank you very much for being here. All right. Well, thanks everybody for and being upfront with your questions. If you have specific questions or you think of something after we get off of the call, you can email your questions to townofcornelius@cornelius.org, and we will also respond to your questions that way. We will get answers and make sure you get the responses that you need. townofcornelius@cornelius.org. So the next topic and the main topic on our Connecting Cornelius Coffee Chat today is the Mayor's Housing Study Committee. And I really am excited about this presentation. It's been an endeavor of mine to address more affordable housing in our community in a variety of ways. And there are a variety of ways you can definitely attack that and make it better. I won't go into the details, but we have an excellent housing committee that I've attended every meeting as far as I know. There's been a lot of subcommittees going on, lots and lots of work. And one of our leaders on that committee is Michelle Hoverson. Michelle's a resident of our town. She lives in Antiquity. She gets it as it relates to the topic. We do have a couple of our Board of Commissioners that are part of this committee, and that would be Commissioner Sansbury and Commissioner Bilodeau. So if they have any comments or questions along the way or input, I welcome them to jump in. So I'm going to turn this over, I think, first of all, to Wayne Heron, who is our staff liaison for housing, and then Michelle Hoverson will be up next.
Thank you, Mayor. And I'm going to very quickly run through some slides that kind of give you the history of what the Mayor's Committee has looked at, because I want to make sure we leave enough time for Michelle to cover. She's doing some very important work with the subcommittee now for some work on establishing a community development corporation, which was one of our short-term goals. So let me just quickly run through some history, and then I'll turn it over to Michelle. But this whole process started, as the mayor mentioned, in 2018, and the mayors got together and said we would like to approach this from a regional standpoint. So we asked the Lake Norman Economic Development Commission to look at some demographic numbers and some housing assessment. The quick thing here that I'll point out, you see down at the bottom, 80% of the people who work in Mecklenburg, North Mecklenburg, live somewhere else. And then very quickly, if you look at this screen, you look at the top, Cornelius at 10, Cornelius at 9, those are the people who are living and working here. So that's 90% who work in Cornelius and drive from elsewhere. That is definitely contributing to some of our traffic and congestion. So the mayor appointed a committee in July of 2020. There were 6 meetings, made a report to the town board in 2021. Now, some of the numbers on this slide, they've already changed. The average 2-bedroom rent, we're at $1,677. And I just haven't changed that on the slide, but that has gone up significantly since we first started looking at this in 2018. And we were doing comparisons just with our telecommunicators here in town and our sergeants to show that they simply can't afford rent and mortgage here in the town of Cornelius. So committee recommendations, and I'm going to not read all this, but the first recommendation was that we needed a comprehensive housing plan. Our county does a lot for housing, and a lot of the money from the county goes to the city of Charlotte because there are no other towns outside of Charlotte who have a comprehensive plan or are interested in tying into it. So recommendation number 1 is we need a comprehensive housing plan. We need a plan that shows the county we're serious, and that if we want to tap into those funds, they will consider us. We talked about location and finance. You can't just squeeze affordable housing in any place. We talked about Bailey Road. We talked about the west side on the lake. The property values on the lake, you just can't put affordable housing on the lake. But we need to look at areas where it's logical. Where's transit? Where are the churches? Where are the grocery stores? Things that people need day to day in their life. We need to look at our land use and zoning. It's no secret that we primarily use conditional zoning in Cornelius. How can we use that to an advantage to help affordable housing and to help housing in general? Historic preservation. There are pros and cons to historic preservation. We all want to preserve history, but sometimes it comes with strings that might prohibit historic preservation. So we want to be able to use it to our advantage. Community and neighborhood consensus. While we all talk about housing, we talk about what we want to improve housing options, we can't just cram it in where we might think best. We need to talk to our neighborhoods. We need to talk to the communities here and make sure there's consensus on the plan that we have to move forward. we need to look at development incentives, and it's not just density. Density incentives have been available in Charlotte and other areas for a long time, and most folks will tell you that and that alone does not solve the housing problem. So we need to look at things about how governments can invest otherwise through purchase of property and donation of property and anything else that might help for redevelopment plans. Town financial participation. There's absolutely no affordable housing plan out there that doesn't work without a local government being financially invested. So that's just something we have to think about. I mentioned the land acquisition. We must continue to develop and maintain our partnerships. We have a lot of great partnerships here now with Ada Jenkins, with the Faith Community, with Habitat. We need to continue to work and develop those. We need to continue to identify resources. There's a lot of private resources. There's a lot of government resources. And that's part of the recommendation with the CDC, to have an agency that can unify and search for those resources. So one of the last ones was the employee housing program. The town currently provides a small stipend to police and fire. The recommendation was the town needed to step up and be a leader, and not only for police and fire, but all employees, to start to curb the affordability issue, and to also encourage other employers in town to follow suit and look at regional solutions. So those are things that we want to continue to do. So out of that came a recommendation for 4 short-term that the town could look at now as far as in our budget cycle, and then continue to look at the long-term as we move forward. Those 4 issues here at the bottom of the screen. We need a community development corporation. A lot of folks say, well, what is that? And I'm going to leave that to Michelle. Michelle has been a leader on the Mayor's Housing Committee and leading a subcommittee to look at developing the CDC. So I'm going to leave that to her. But then second and third was, we need to maybe ask the CDC to look at rental assistance, to look at transitional housing, and maybe just take the lead on the town's housing program. But then the last bullet, recommend that the town expand and grow the incentive pay for town employees to encourage and help town employees to reside in Cornelius. Based on the town board receiving these summary recommendations, and these were considered the short-term recommendations, again, we're expecting Michelle and her committee to come back with short-term budgetary requests, and the town manager is also working on the short-term budget that he'll discuss with the board in the upcoming budget meeting about incentive pay for town employees. Just a couple other data points. Median values at 500. I don't have the average listed here, but we know that the average home in Cornelius is at $397. Median monthly rent, $1,875. I want to also talk about the commuting. The sweet spot here is what you see in the middle. You see that's a very small little section there of people who live and work here. So if we can improve that with better affordable housing, that will certainly help all of us. So I'm going to stop there, and I'm going to let Michelle pick up and talk about the very important work her committee is doing for the short-term goal of the Community Development Corporation.
Thank you, Wayne, and good morning to everyone. As Wayne said, I'm just really representing a much larger team that has been working on this for a couple of years, and I just want to take a few minutes to explain where we are and how a CDC will foster greater affordability of housing in the Cornelius area. So the first thing that I just wanted to communicate is that there is a consensus that our citizens desire stable housing. Those that work here, live here, own businesses here, want to see stable housing for everyone. And our town leaders really desire to expand affordable and transitional housing options within Cornelius. And we came to a point where our Affordable Housing Task Force fully endorsed the establishment of a Cornelius CDC, which stands for Community Development Corporation. I think when we talk about certain terms, it's important that we define the terms because there are a lot of misunderstandings regarding affordable housing. Affordable housing is basically housing that a household can pay for while still having money left over for other necessities like food, transportation, and their health care. It can be either ownership or rental dwellings. So a perfect example of affordable housing, several months ago, I needed to help an individual, a friend, who is a small business owner in Cornelius, raising 3 children. And because their current rental property was being sold, had to find other rental property. Well, a small business owner has very tight margins, and the lowest rent that she could find was $1,900 a month, which meant she had to have an additional person go on the lease. And it was just a very complicated situation in order to make it possible for her to stay within the community in which she owns a business. So affordable housing is a very broad term that just allows people to have money left over for other necessities after they have paid for either their ownership or their rental of their home. Transitional housing, however, is intended to bridge a gap from situational homelessness to permanent housing. And within Cornelius, we want to see that transitional housing offering structured holistic services to ensure that that individual has long-term success and moves on to either successful rental or home ownership. And there's some examples listed there for you. So exactly what is a CDC? Well, the Cornelius Community Development Corporation will be an independent, resident governed nonprofit, so 501c3, that reflects our community and then has a contractual relationship with the town of Cornelius on various projects. While a CDC works closely with the local government, they are not a government entity. And because they are a nonprofit, they're in a position to be able to receive tax exempt dollars and can receive funding from private sources, public sources, state and federal grants, block grants from HUD, and also philanthropic foundations and private individuals. So a CDC follows a bottom-up approach. They're set up and run by community members with representation from citizens who live in the community, a couple of which will actually live in affordable housing, as well as a few representatives from the public sector will serve on the board of the CDC. So one of the things that the CDC serves as is a fiscal agent. They raise funds, they assure that funding that is raised meets the initiatives of that funding criteria. They serve as a catalyst for affordable and or transitional housing projects. They collaborate with all the community partners that Wayne listed earlier in his presentation. So working with Habitat, working with Ada Jenkins, working with our faith-based community. They provide educational programs, both to the community to understand what the housing programs are, but then also providing educational programs with partners to those who want to move from rental to ownership or who want to take advantage of housing programs that are being made available within the town. And then just provide community communications, which can be a whole range of communications, everything from helping to communicate the town's larger master plan to different projects that are underway. So we have actually the phase one of establishing the CDC is to submit all of our documentation for 501c3 and incorporations, incorporate ourselves, which we're actually underway doing that right now. And then as we apply for some budget dollars, we'll actually retain a consultant pursuant to funding requirements. We will request some budget dollars from the town, but we will also be raising money from outside sources as well. Then as we're established, we actually will be looking into developing a transitional housing program. And then we're going to be partnering with Smithville Redevelopment Project and identifying the steps that we need to take to successfully partner with them. And we'll begin to identify a neighborhood revitalization project that might begin to start in 2003. We also, as you saw, as part of those short-term goals, rental assistance, where we've already begun, even before being incorporated, just kind of on our own time, we've begun to identify what are the various rental assistance programs that are available within our community. And then we'll be looking at what are the gaps, and then what would be a practical way to meet one of those gaps. So once we're fully established and have secured some funding, then we'll begin to expand our funding streams with philanthropic organizations, other government entities, and private individuals. And we'll begin to communicate what's happening with the CDC throughout our community. So I think the main thing to point out, and this will be probably the last slide that I share, is that CDCs are not new. There are other CDCs within our area, within this area of North Carolina, that we can glean from, but they're not new, but those of us working on this are a little new at utilizing it. So we're going to start out slowly and do our homework and do things well, and then the CDC will grow in what we take on and what we focus on as we have some successes. So as I said, our first project will be a transitional housing project, and we don't really know exactly what that's going to look like. This is kind of our vision. These bullet points reflect our vision of how it might look, but we'll be diving into this more once we get our full status from the state. So it's a great future ahead of us. This is going to be very unique to Cornelius. And we're looking forward to getting it underway.
Hey, Michelle or Wayne, I think this is a good question for you to answer for the group. Mike Zanger actually sent this to us, and he wants to know, what can this new group, i.e. the CDC, do that the town council cannot? I just want to get an idea of the benefit for the new cost that would be. I guess he's talking about that would be town cost and so forth.
Right.
So,
and that's an excellent question, a very practical question. And Wayne, you can add to this, please. But one of the things is, because the CDC is a nonprofit entity, it is able to raise funds that the town commissioners would not be able to access. So a CDC is able to go to places like Foundation for the Carolinas. We're able to go to the county. We're able to go to other philanthropic organizations, to corporations, and raise funding for affordable housing projects. And the town is limited by its budget, but a CDC is not limited by the town's budget.
And also what we've learned is there are millions and millions of dollars out there through corporate contributions and the CDC Foundation, as you mentioned, Michelle, that are available that we just simply could not solicit as a town government. people will give to a nonprofit whereby they would not give to a town for lots of reasons. So that would be something I would add. Wayne, what else would you add?
No, I think both of you hit that perfectly. I think as far as the budget in the short term, we're looking for Michelle's committee to submit a very small startup seed money request from the town. And then from there, a lot of these foundations provide administrative funds and provide other things as the CDC gets up and going. And this is a role model that other CDCs have followed. They go out and find other sources and they grow from there and are able just to seek other sources of funding for our community in partnership with Habitat, Ada Jenkins, and so in the faith-based community. So it's our goal that we can possibly put a little seed money into it. And Michelle, anything you'd like to add from there?
Well, I was just going to say that seed money, to show that seed money is very important in receiving the early contributions from some of those outside organizations. Yes. They want to see that there is this partnership between the town and the CDC. So it all kind of works together. To be, for these funds to come in, you have to show some support from your town.
Yeah, I think in effect, the town would be a small incubator in terms of funding to really fix a big problem in our community and really seek a wide range of funding, which will make a difference, I think. So quickly, either Commissioner Sansbury or Billady, do you have anything to add? I know Commissioner Billady's been working with this committee quite a while.
Yeah, thank you, Mayor. And I think Wayne knows his audience when he said request a small amount of dollars from the town. It is budget season, and Michelle has made such great points in her presentation. The thing not to overlook is that we go into longer term activity on a more regional basis. But I want to be absolutely sure, and Mayor, you're right, for the longest time, I've felt that what we've got to do locally for our first responders, which is twofold. It helps with the housing situation, but also with retention and recruitment. What we need to do is make something that's meaningful before we start spreading out too far. Budgets are limited, but I want to make sure we work with the chief, both fire and police, and find out what is meaningful that we can provide through a town budget, what's meaningful and reasonable to help the cause. So I appreciate all that the work that's being done by the committee.
Todd, do you have anything to add?
Well, no, I agree with Commissioner Billady. I think we have some targeted, areas of our population that could really benefit from this. And I just want to commend Mayor, you and the committee, Michelle, for the hard work you've done. And I look forward to some really solid results.
Great. One other quick question, and we'll need to wrap up here shortly. From Bob Bruton, he asked, has Cornelius set a percentage goal for the number of citizens that work locally? The answer to that is no, we have not, but I'll turn to Wayne for any additional comments. I think we will work toward setting a goal at some point in time, but as of yet, we're not there.
Mayor, you're right. We haven't set a number. I think right now our goal is just to increase the number of people who live in Cornelius. I think right now we're more into identifying what our issues are and what our funding sources are, just to see if we can increase that percentage of folks who live here.
Great. Thank you. Thank you so much. So we're right at our sign-off time here. I'd like to remind everyone that this is being recorded. Some folks wanted more history and details. If you'd like to go back and listen again, you'll be able to do that on the town's Facebook page. So Town of Cornelius Facebook page will be available, and this particular presentation will be out there for your review. So good job, everybody. Anybody have anything else quick to add in relation to the topic of affordable housing? Thank you, committee. I'm sure we've got some of our committee members that have joined in today. We have a really, really great, highly involved committee that has truly made a difference. And we've taken a deep dive into this for some months now. I'm proud of this committee because there have been other committees in the past that have tried and really not gotten to the table. So we are there now, and it's a matter of now seeing it through. Let me look at our questions one more time. I think that's going to probably address that, and I think Maylene can address the other things that are coming in. So thank you, everybody. One of the things that I will do is we're making great progress on input from our budget survey. The town manager constructed a survey. We put it out online. You can have the opportunity to provide your input as a citizen to our budget process and your priorities. And we want to know that as we move forward. We're on track to hopefully break a record as it relates to the number of folks that are responding. It's not too late to respond. You can go on the town website, cornelius.org, and find that survey. And we really, really invite you to participate in it and give us your feedback. So with that, we'll end our presentation today. Be safe, everybody. We thank you for joining us, and we'll be back up again first Monday in April. See you then. Have a great day, y'all.